Happy New Year! I am very excited to see those of you who I work with regularly very soon. And for those of you who I haven't had the chance to work with yet, it's really wonderful to meet you. I'm going to be your head coach for the World University Games, and working together with your team leader, Christy, and your assistant coach, Kyle, we have put together the first resource for you, and I'm going to be going through the anti-doping policy with you in just a moment. But as your head coach, I want to also introduce myself in the context and the role that I'll be playing for this event. That is, in my role, I'm going to be responsible for all of those things that directly affect you as an athlete in order to perform, to be ready to perform, to prepare your body, your mind, and all other aspects of self for readiness to perform. But I'm also going to be responsible for helping you recover. So things like massage and yoga, turning around to be able to compete again, perhaps in some cases the next day. So I'm responsible for all of that area of your competition, and I'll be assisted by Kyle, and of course, the others in our team we will interface with regularly. So for this first piece of readiness, it's really important to introduce you to one of our very favorite sayings on our team, which is, a hot body is nothing without a sexy mind. And the anti-doping policy is absolutely a great example of that. You all know that Soonbi was stripped of his 2014 World Cup ranking as well as his 2014 Tour de Ski win because of a doping issue, and you all know that Johag is not competing this season because of the same doping issue. So we're going to go into that, because the thing about the doping policy is that it's not straightforward. It's not easy. You have to have a really sexy mind in order to understand it, because many of these things are just medications that people do take, and they do take for very real issues, so you need to be aware of them. You need to be aware because, as we said, you lose all of your bragging rights, you're disqualified, you're ineligible, you also pay a financial consequence, and of course the embarrassment is a big piece of why you don't want to get involved in any kind of a doping scandal. So let's take a minute to say, what are some of the things that we hope you're not doing, and also that we want to make you aware of, that if you are, you need some sort of therapeutic use exemption form. And so right now is a great time to get that done. So what are some of the things that are banned? We don't want to see any of these things showing up. Well, it sounds easy to say that we don't want you to take steroids. It's like, yeah, no, duh, we know that. But the hard part about this is that this includes drugs. These are drugs that are sometimes used to treat very real conditions like endometriosis and endocarditis and certain breathing disorders. So anabolic agents are not so straightforward as just saying don't take steroids. You also need to check into if you have a condition such as one of those that I mentioned, or you're taking something like Tibafem or clenbuterol, anything like that. You need to recognize that this is a banned substance. You need to get a therapeutic use exemption form. Peptide hormones, growth factors, related substances, and mimetics. This includes a number of different things. And Kyle has written any molecule or drug that alters the chemical balance in your body. And this is true. Things like the erythropoietin receptor agonists that give you more red blood cells. Well, we know that about doping. But these also include things like cobalt, xenon, and argon. Remember when that got really popular with the Russians. So these are all things that have been done and are performance enhancing. So how about things like hormones and metabolic modulators? Well, this is, again, not so straightforward as it sounds. So things that reduce estrogen levels or upregulate your metabolic processes. This can be things like insulin. So if you are dealing with, if you're diabetic and you take insulin, we need to look into that therapeutic use exemption form. Beta-2 agonists, once again, these are the drugs that treat asthma. So if you're on Symbicort, if you take breath air or breathine, these are things that we need to talk about getting therapeutic use exemptions, or if you are, treated for asthma, recognizing that the amount matters. So this is the area where our favorite Norwegian skiers got in trouble. They were taking beta-2 agonists in many cases, even when they didn't have asthma. And so that obviously is not, it's a no-go. So if you're talking about some of the popular inhalers, there are some of those that are not included. So salbutamol is a good example of this, as long as it's not in excess. So you'll want to make sure that you're not taking, it's not one of those things like, oh man, more is better, because if you're exceeding the allowed amounts of your inhalers, then that can be problematic. This includes things like diuretics and masking agents. And while this sounds like something, of course, you wouldn't be doing, these are things that alter blood plasma volume or change blood pressure, but also these are things that are drugs that are used to treat cancer. So it's interesting, when I looked at this list, tamoxifen is on that. It's one that's used to prevent breast cancer. I was just like, I literally had my jaw drop when I went to my mother's chemotherapy appointment with her, and the doctor said, well, you may be at higher risk for this, so you can always take these things prophylactically. That means preventatively. And I was like, what? So people are doing it. So definitely something to be aware of. These are also drugs that are used to treat coronary artery diseases. So I'm just going to show you for a minute the World Anti-Doping Code, and please take time, to scan through this and look at the WADA standards so that you can see these full lists if you have any concerns at all. But these just literally go on and on and on and list all of these banned substances. And so it is important that if you are taking anything, you should look and see, is this on the list? So long lists of many of the things that we've talked about, and I've tried to simplify, and with, of course, Kyle's help, trying to simplify this down to something that is a little bit easier to understand. So let's talk now about some of the prohibited substances that are things that might be painkillers and whatnot. So let's begin with stimulants, anything that boosts wakefulness or attention. Well, hey folks, this includes your ADD and your ADHD drugs. So if you're taking Ritalin, methylphenidate, if you're taking Adderall for your ADD or your ADHD, it's something you're going to have to bear in mind is going to need a TUE, or you're going to have to go off of that. Narcotics, these are painkillers. You need to think about things like Demerol as a painkiller. Cannabinoids, this is a big one because two of the states that some of you are coming from, Colorado and Oregon, it's legal. And yes, it's legal, but it's not allowed in competition. So, and the worst part of this is that it stays in your system for up to 90 days. So that means that you definitely need to stop smoking pot. In fact, I hope you stopped smoking pot the minute you found out you were on the World University Games team, because it'll stay in your system for quite a long time. Then the glucocorticoids prevent inflammation. If you've heard of things like Dexpac, this is a glucocorticoid. So if you're on anything that is to prevent an inflammatory disease, take note. Now here's this information about the therapeutic use exemptions, and I put a link to how to find out how to apply for a therapeutic use exemption, and that is something you maybe want to think about doing. So I hope that this has been a super helpful anti-doping quick reference, and I will be sending the actual document along with the link to this vodcast. So can't wait to see you all.